If anyone is wondering what we're doing sitting on the floor, it's because I'm going to present a very, very interesting and great minimally invasive case. So Sebastian is here with me, also on the floor, and of course, so am I, right? Fantastic. You know, the reason why this is kind of like the first one that we do this way, I think it's, I just wanted to give a little bit of background on specifically this one, just because we're doing a lot of work. This patient is a young patient, 25-year-old who presents with bilateral, left and right, flat feet, okay, flexible flat feet, bilateral left and right bunion deformities, bilateral left and right hammer toe deformities of both little, the pinky toes, the fifth toes, what we call the little shrimps, and then multiple hammer toe deformities, mallet toes, right? This is a mallet toe. And this is all at the core as a result of the flat feet, the flat foot deformities. So this week, we will be performing many procedures to kind of just, you know, reconstruct, if you will. We're going to put things sort of where they belong, and we're going to make both of her feet really, really pretty. So Sebastian is going to hand me over the phone. And by the way, I just want to be very clear. These procedures, we're going to be doing it in our office-based surgical suite under local anesthesia. The patient will be awake. We will give the patient a little something to relax. Very, very important. The patient will be walking in the office and walking out of the office. The patient will be able to use, obviously, any, whether it's crutches, any rolling walker, any devices to be able to get around, move around. You know, this is, anytime that we do a lot of procedures, that kind of falls into the category of the Cinderella type of procedure. That's not something that I coined, but I think that, you know, the outcome is going to be really, really nice. So I love these cases where there is a huge transformation. It's hard for, obviously, patients to see through and see the transformation at this point, but I can. Let's present the case. Okay, so these are both of left and right foot. Let's take a look at the right foot. So basically what we're going to be doing, we're going to be correcting the bunion, okay? Leave it nice and straight. No bump, number one. Number two, the little shrimp here, we're going to be correcting that. She's got a little tiny little bump here, okay? That's called a Taylor's bunionette, right? This is the normal bunion, Taylor's bunionette. And we're going to be also, you know, correcting this as well. In respect to the second, third, and fourth toes, the second looks perfect. The third and the fourth, as everyone can see, this is where we see the little mallet toe, right? The little mallet. The tips of the toes are looking down. So there's a possibility that we may release, right? Release the tendon that is causing the deformity, and then that will straighten out the tips of the toes. In respect to the left, same thing. You know, we have the bunion. There is a little bit of webbing. This is not something that she chose. That came the minute that she was born with it, right? In respect to the second toe, then there's also another saying, the nail never lies, right? The nail, wherever the nail's pointing, that's where the toe's pointing. So this may actually look a little bit better, right? Kind of like that. And that's something that the patient will also consider. Again, that's sort of where it sits, and we may do this. Same thing in respect to 3 and 4, the little mallet, and then we'll definitely, you know, consider releasing the tendons, and also the shrimp, which is the hammer toe. No Taylor's bunionette on this side. Sometimes they're bilateral left to right, in this case only the right. Now, the grand finale, so to speak, there are these little implants that we can actually insert into a joint right on this side through right here. And these implants are called subtalar joint implants. Subtalar joint is the joint where we actually insert it. If you want to make believe, it's kind of like a little pillow. It's a firm pillow that you can actually put inside that joint. And when we do that, we can actually correct the flat foot to a certain degree and extent. The patient, two things. Number one, two main reasons why we're doing this. And again, it's going to be the left and the right, okay? We don't do it on only one. Number one, prevention from from the patient eventually. Again, she's very, very young, 25 years old, that maybe 20 years down the line, because of her deformity, she may experience a lot of pain as a result of, dysfunction of that tendon that holds the arch. So that will definitely help her, number one. Number two, it will actually, these implants, you can actually recreate a little bit of that arch. So the patient is not, from an aesthetic standpoint, right, a cosmetic standpoint, she's not super duper thrilled with the fact that her feet kind of just, fall over, right? They just kind of roll over. And with this little implant, we can actually correct that. And, again, the flat foot is a very deforming force, structurally speaking and biomechanically speaking. So I think this is a great case. This is a great, great case for a lot of reasons. I know this is quite a lengthy video, not as, not as short as the others, but I think that, we needed to really, really, take the opportunity to explain to the public, play by play, exactly what we're going to be doing. Mm-hmm. We're looking forward to this one. This is a good one. The transformation is going to be fantastic. Like always, www.jawspodiatry.com, Instagram, Dr. Toe Jam, Jaws Podiatry, Facebook, and last but not least, our YouTube channel, Jaws Healthcare. I will definitely keep everyone afloat on this patient's progress, and I will probably